Mhm. Hi, everyone. This is the next part of our lecture 2.3 on human growth and development for my Psych 108 classes. Let me share my screen. Kind of put these two together to make it a little easier to film. Here we go. Okay, so birth. Let me grab that and pull that. Going to be stubborn. There we go. Much better. So, from labor to delivery, basically. So, 266 days. Of course, everyone's just a little bit off, that date. That depends on each individual person. Uh, a hormone triggers birth, okay? Oxytocin is delivered from the mother's pituitary, and once the level gets high enough, then contractions begin. So sometimes women have what's called false labor. That's the Braxton Hicks contractions, which means she's not quite ready. So she may be at the hospital for a few hours, but eventually sent home. But as the process continues, the development of the fetus makes basically the uh, birth happen because babies couldn't last longer than 9 months or more than a week or two after because mom would not have a sufficient food supply in order to provide for the developing fetus. So if you're looking at this chart, you see the three stages of labor, and there are the three stages. So we have contractions, eventually the baby is moving into the birth canal, and this allows the baby's head to pass through. And uh, then we have the stage two that takes typically around 90 minutes, but again, everyone is different. And then people always forget stage three, which is the delivery of the placenta. So there are three distinct stages. First stage, of course, is the longest. So we have the mother's cervix opening. The labor can last anywhere from 16 to 24 hours. If your mom is still living and you have the opportunity to ask her, you may want to ask how long your uh, labor was to deliver you. If it was really long, maybe you might want to buy her some flowers or some candy and say, "Thanks, Mom." If you're already a mom, you've already been through this and you can understand. It tends to be shorter for the next children following. That first one is typically the longest of delivery. That baby, as I said, moves through the birth canal. Sometimes an episiotomy needs to be done where they actually make an incision to make the opening wider for the delivery of the baby. And of course, stage two ends when the baby's born, and then stage three, shortest stage, is the umbilical cord and the placenta are expelled. Only last a couple minutes. So they go from fetus to a neonate. Babies cry many times immediately to clear their lungs and breathe. Typically, it's a nurse who is in charge of doing the ABCAR scale reading. It's typically done at like 1 in 5 minutes. Uh, so it's looking for certain things that um, should be happening at a particular point in after the delivery. So final number should be 0 to 10. Of course, anything under 4 means that there's a problem with the baby. And here's the scale, as you can see. So ABCAR comes from appearance, pulse, grimace, activity, and respiration, and points are from 0 to 2. So, like I said, at 1 minute, and then again at 5 minutes after birth. So sometimes babies take a little longer. So in the first score, after 1 minute, they may be lower, but um, after a couple more minutes, their scores come up. So, but any baby with an APGAR score of under 4 needs immediate resuscitation. There are medical screenings that are done and test for approximately 29 different disorders. It depends on what state you're in. And the reason is for early treatment. Um, if it's something that we can do something about, and good for parents to know ahead of time. Physical appearance, babies are covered with vernix uh, to aid in the passage through the birth canal. There's like a fine, dark, fuzzy material called Lanego that also is to kind of protect the skin. Eyelids, of course, may be swollen and puffy from just all the fluid built up. And there is a controversy about bonding. Does the baby need to be skin to skin contact immediately? Does it make a difference in bonding if the baby bonds immediately with the mother, the father, or if it's sometime after that period? A lot of it is, if a C-section had to be performed, that skin to skin contact isn't happening immediately. Does that affect in any way bonding? And for the most part, the research says no. Now, we do see some research on bonding in the kangaroo method for babies that are preemies, and we can talk more about that in class. So we have the Lamaze method, Bradley, hypnobirthing, and water birthing. Lamaze, of course, is breathing, and um, many women do the Lamaze method. They usually take a partner with them. It doesn't necessarily have to be the father, but someone who's going to be there and kind of support them through labor and delivery. Some people choose to do water birthing since, the fetus is in, warm fluid. Birth into water would seem like a natural thing. Hypnobirthing, no drugs, just hypnosis. And I've known a few people that have had this done, and they've, had nothing but good to say about it. So that's a possibility too. Who is going to be there to deliver? Obstetrics is your OGBYN, you know, uh, traditional hospital delivery. You know, midwife or doula may or may not be connected with a hospital or a home birth many times. Midwife for years because doctors couldn't get around. They were trained to deliver babies. And the doula is a support for before and after the delivery and also to be there during the delivery. I had a student a few years ago who was a doula, and right in the middle of human growth and development class, she's like, "Excuse me, I have to go. My uh, woman that I'm, you know, caring for, she is in the process of delivering her baby." So I uh I just laughed because we had just finished childbirthing like a couple weeks before, and she had shared some of the thoughts, so we were all excited when she called us and let us know it was a little boy. Some people decide they do not want external drugs. They don't want an epidural, which basically is an injection that's going to alleviate the pain. You're not going to feel the intense pain. Doesn't necessarily get rid of all of it, but it does definitely reduce the pain. Uh, there are different types of epidural depending on if it's the full thing where you really don't feel much of anything, or spinal. People who have back issues also may have had like a spinal epidural. Uh, like if you have herniated disc or disc laying on a nerve, things like that. Some research shows that it might depress the flow of oxygen to the fetus and slowing labor, but no, none of the studies definitively say that this is, a harmful thing for the fetus. Post-delivery, usually it's about 2 days now. On average, in the 70s, not so long ago, it was about 3.9, about 4 days. In the 90s, it dropped to about 2 days. Pediatrics, uh, the Academy of Pediatrics says that women should stay 2 days, and Congress actually passed legislation for that to happen. So insurance companies are required to cover 2 days for childbirth. So how do you make labor a more positive experience? Well, one, be flexible, be prepared, be, communicative with your healthcare providers and the people who are with you. Remember, it's called labor for a reason. It's not fun and games. You're not going on a picnic. Uh, accept the partner support and the people who are with you to support you, especially other people who may have gone through it. They can give you some great advice. Be realistic and honest about your reactions to pain. So, if you have a very low threshold of pain, you may want to take the drugs. Um, if you're good, a headache, migraine doesn't send you through the roof, then okay, go for it. Maybe you want to get that full experience of labor, and it's not your thing. The next time you have a child, you can decide to do the epidural. Focus on the big picture. Plus, also, that person is with you. They can support you. They can rub your back. It's typically lower back. Keeping you relaxed, keeping you breathing, all important things. And then the review, and the review, and then sample questions, and another sample question. Let me stop the share for just one. Okay, let's continue on this next section. Let me share again. Okay, so some complications that can occur. Preterm, or infants before 38 weeks are at risk for, illness or death. Low birth weight is one of the biggest things. Infants weighing less than 2,500 grams. It's a difference for small for gestational age, just some infants, about 90% or less of average weight infants are of the same size, gestational age. Preterm benefits from responsive, stimulated, organized care have shown very, very beneficial. There are a lot of respiratory issues depending on how early the baby is born. They may be placed in an incubator. I mentioned kangaroo contact before. That's skin to skin, just for research sake, there's a lot of positive research that says that actually can be very beneficial in helping the infant uh, thrive. Whereas before, without that, they did not have that same experience. Mortality rates, of course, you know, mortality rates around the world, but the United States still has a pretty high rate when you think that compared to other industrialized countries. So that's something that we're still concerned with. Development for preterm infants is always slower. Sometimes small, subtle problems emerge after birth, may have like learning disabilities or a lower IQ score, may call for some types of educational interventions. This is where milestones would be really important that you would watch, and uh, your doctor would also be noting maybe of slight greater risk for types of mental illness. Some may have some difficulties with physical coordination, may have some issues with eventually crawling or scooting, and then later on walking. Around 60% are free of everything, just as if they would have been born uh, at 38 weeks or above. Very low birth weight. This is the smallest of the small. We're talking those the left leave that weigh less than 2.25 pounds, or gestation less than 30 weeks. Very severe danger of immature organs. The age of viability is about 22 weeks. So at 22 weeks, there's a chance of survival. Anything prior to that, no. Babies born earlier than 25 weeks, it's about a 50-50 chance of survival if they can get that baby uh, to a facility immediately. The cost of care is very high, very long period of time. It can be very, very stressful on the family and, of course, on the infant and even the nursing staff as they wait for small changes. What causes preterm low birth weight? Multiple births, of course, if you have more than one. Very young mothers, uh, births that are spaced too closely together. You can wait 6 months in between. General health and nutrition of the mother. African American mothers have double the chance of having a low birth weight baby. Another one is smoking, so that can also affect a birth weight. Uh, Post-mature, these are ones that are still aren't born after 2 weeks due to the mother's, date, and they risk health risks too because the blood supply is decreased to the brain, and it can make delivery much more difficult because the baby is larger, tends to be a C-section at that point. More than 1 million C-section deliveries are done each year. The baby's surgically removed from the uterus. Several difficulties can lead to a cesarean section delivery. Anytime, of course, the fetus appears to be in danger, since the goal is to help the baby in all ways possible. Any mothers over 40 may have a higher risk. Of course, breech baby, that's when the feet are coming out first instead of the head. Transverse position, again, any type of tangling or, cord around the neck, etc. And if the baby's head is very large and mom in particular is very small, which could put the baby in difficulty. During delivery, fetal monitors are, used to help increase the success of birth because it increases cesarean rates because they can monitor the baby. Some criticisms are that there's not enough research on cesarean and the, successful birth consequences, major surgery, you're doing a C-section. It's going to take longer for mom to recover. Once her baby develops, it takes a while before she can even hold her baby in the size. Risk of infection always. It may cause a change in the hormones. So dealing with stress after the birth. Babies tend to be more prone to breathing problems. There's not a lot of research on that, but that's still being done. And they don't pick it as a routine thing to do. I mentioned about how high the rate of C-sections are, like in the United States. It's amazing how some people just want their baby to be born on a certain date, and if they can find a doctor, they'll have that baby on that date. I had a student a few years ago that wanted to watch the Super Bowl, and she was due on the Super Bowl, and she didn't want to miss the Super Bowl, so she insisted to her doctor to have her baby due at least 2 days before. And she had a C-section. She wasn't scheduled to have a C-section, but she ended up having a C-section. So occasionally it does happen. But that shouldn't be the reason why you have a C-section. Stillbirth and infant mortality, death in the first year of life is just terrible, psychologically horrible for the family. Luckily, the rate is declining. Babies that are born not alive, about 1 in 100. That's still one too many. Parents will grieve just as if it was an older loved one had died. Uh, yeah, this was your child developing for 9 months, or after the baby's born and the baby seems perfectly healthy and the baby passes during the night. Postpartum depression, also called the baby blues, that's a real thing. Don't let anybody tell you that it's not. The joy of having this beautiful baby and then depression. Hormone changes happen very, very quickly. It's the period following childbirth. It affects about 10% of new mothers and can last for months, even years. I know personally my mom actually had that. My grandmother had to stay with her to help her. It was her first and only child. And the depression just kind of set in. Now, she told me it wasn't long, it was about a month, but she didn't think she could do it on her own. So luckily she had the support, and that's what's really key here, to support those mothers in those early days. Much of it is triggered by hormones, but anytime the new mother is in need, I always tell people who want to do something, sure, they need baby clothes and yeah, they need diapers and all this other stuff, but give them a couple hours of your time so they can take a nap or offer to clean up the house for them, or give them a break. And if they're using formula or if they're need to go to the store, do that for them. That can be sometimes so much better than a couple more onesies. Again, infant mortality rate is higher in the United States than in many other countries. That low birth weight, preterm deliveries. We still have many people living in poverty that don't get adequate medical care. Many other countries provide low-cost prenatal care for free. There's many women in the United States that have had no prenatal care since the 1990s, and it would be great if we could at least offer free or inexpensive health care for women who are pregnant. And review and review. Sample question, sample question. And let's talk quickly about reflexes. Do the share. So these are anything that's unlearned. I'm sure you've learned about them in Intro to Psych, sucking, swallow, rooting reflex, startle reflex, Babinski, Moro, etc. are just some of the reflexes. They're all listed in your textbook. I'll also talk about a few of them in next week's class. When we talk about vision is the worst developed of the senses. It doesn't really truly develop until around 6 months. Auditory systems are not fully developed, but much better than visual. They're very, very sensitive to touch. Their senses of taste and smell are definitely well developed. A baby can pick out their nursing mom in a room full of other nursing mothers. She or he could smell her breast milk. Circumcision, there's still a debate. Is it medically necessary? Many say it protects against sexually transmitted diseases. It can come with complications. That's a definite. Some believe it reduces sensation and pleasure for later on in life. Stress, pain, procedures not well, you know, treated, etc. But later on in life, if older men choose to have that circumcision, it is much more painful than if they are baby. And we will talk about this in the next class because I want to review a little on classical conditioning, operant conditioning, and habituation. So I just put it on this slide, but this is actually where we'll start next class. I just wanted to say have a great day and see you next time.